As healthcare workers are celebrated on one hand for their advancement in finding out a vaccine, scientists as well, other counterparts are feeling at risk, and those battling with COVID-19 in the country, to be specific, have described the experience of being in the front lines as scary, not knowing if they will live to see the next day. Working in difficult conditions without personal protective equipment has led some to contract the virus. Kevin Mutai tells a story of a consultant obstetrician, who is currently in isolation fighting COVID-19.
Janet Gidinji, a consultant obstetrician and gynecologist, is among many of the frontline workers who have contracted COVID-19 in the country. She is a soldier who has been forced into isolation by the invisible enemy.
Today, I am on my day 9 of isolation as a result of having contracted COVID-19. It is scary, and it's only going to get worse because now the phase that we are on is the community spread. We are on the second wave. It's causing more havoc. I'm afraid to just think about what this means for us as a community, what this means for us as a country. Because if we don't do a lot even right now to just try and turn this thing around, we're going to lose many more lives. As we speak now, we are at, I think, 12 doctors.
The number of doctors...
In a two-day virtual meeting, the Senate's Committee on Health listened to concerns from medics, some of whom feel frustrated and exposed to the disease by the system that ought to have protected them.
We were also scared, but we didn't have time to be scared. There are moments we did not have equipment. We did not have the personal protective equipment.
Neglecting our soldiers would be tantamount to facing an enemy without any defense. And the needs of our soldiers, therefore, must be met in order for them to render their services to protect us all.
Are you aware of the recycling of the PPEs and the masks, the 3M masks? A nurse from yesterday told us that they are being forced to recycle 3M masks.
All this is made worse by the fact that many hospitals are filled to capacity with COVID-19 patients, while others are ill-equipped to fight the disease. Some counties are yet to reach the required capacity of 300 beds. The healthcare workers are also concerned by the number of doctors dying due to the virus, thus weakening the workforce that is fighting the pandemic.
The country is being served by only 9,367 doctors.
The ratios of doctors to patients in this country is well above 1:1,000. So when one doctor succumbs, or if one doctor is out of service, there are 1,000 patients plus who are missing the service that is supposed to be rendered by that doctor.
Yes, we can push that we need ventilators, we need ICU beds. But what is the use of pushing to have 500 ICU beds when you don't have people to work in them? We can dump patients there and they will die.
These grievances have led the doctors to warn that they will down their tools if the government fails to meet their demands. Kevin Mutai, NTV, Mombasa.